Mr. Lyons. I'm going to be your nurse today. How are you doing? That's good. So your doctor says that you need to have 1 unit of red blood cells because your hemoglobin is low after your surgery. So I'm going to make sure that things are okay to go in your chart. So we need to make sure that we have your consent form signed by the physician, and it is here. And we've got the doctor's order to give you a unit of blood over 3 hours. And you must make sure that you've got your name band on. Can you tell me your name? And he tells me that it's Bart Lyons, and his date of birth is March 30th, 1958. I'm going to make sure that I have my equipment. So I've got vital sign machine hooked up. I've got an IV pump, and he's also got the appropriate size IV catheter in place. It's a 20 gauge that's in right now. And right now I've already got a 1 liter bag of normal saline primed with a continue flow set for potential reactions that might happen. Because this IV is a saline lock, I'm going to flush the IV just to make sure that it is patent. So I'm going to aspirate back on my IV, and I get some blood there, and it flushes easy. And I'm going to flush with 3 to 5 mLs, so I know that my IV is functioning. Next thing that I'm going to do is get my 250 ml bag of normal saline and check the expiry dates. I need the garbage can. So 250 ml bag of normal saline. And I'm going to get my white type blood administration set. When you take it out of the package, just make sure that you get all the clamps clamped. So there's the 2 Y type and then the bottom roller clamp. And then we can spike our bag and prime our tubing. You'll want to open up the clamp with the normal saline and open up your bottom clamp. So make sure that your tubing is free of any bubbles. So that's ready to go when I get my blood. Next thing is just to do my pre-assessment of my patient. So I want to do a physical health assessment, making sure that I listen to his chest sounds, getting his baseline vitals, and I can start writing this down on the appropriate paperwork. So you want to make sure that you have your cumulative blood product record, and you can start filling that out. And the time is 10 o'clock. I'm going to write down his temperature because it's 36.5, his heart rate is 72, his blood pressure is 112 on 77, and his sats are 98% on room air. And his respirations, you'd count them for a minute. So the blood bank would need to have a few things faxed down to them. They'd have to have the doctor's orders faxed, as well as the request for release of blood product. So you'd want to make sure that you fill out everything that you need to fill out on here. What ward he's on the surgical floor. Write in the ward's phone number, who the ordering doctor was, and what is the clinical indication. So he's post-surgery and he's got a low hemoglobin. And just make sure that you sign it and you're comparing it to your physician's orders, and both of those will get faxed down to the blood bank. Next is when the blood bank it has completed their cross match, a healthcare aide or a unit clerk or a student nurse will go down to the blood bank and we'll go pick it up. Thank you.
You're welcome.
So it must take 2 nurses in order to check the blood. So I'm going to get Tracy to be my second nurse. So I can, if you want to read I'll read his tag if you read
Sure.
this. So the first check is the record of transfusion to his patient ID. So I'm going to say his first name and last name and spell it out for you, Tracy. It's Bart Lyons and it's Bartlyons.
I have Bart Lyons, Bartlyons.
His PIN number is 92854074.
I have 92854074.
And his date of birth is March 30th, 1958.
March 30th, 1958.
His doctor is Dr. Melville.
Dr. Melville,
And his medical record number is 681834.
681834.
So that's your first check completed because you're making sure that the top half of the record of transfusion matches our patient ID. So it's just specifically patient to patient. The next part is the requisition, and I'll hand that to you. To the tag on the blood bag. And so here we're going to do patient identification as well as the donor number. So I'll start here, Tracy, but it's Bart Lyons, Bartlyons.
I have Bart Lyons, Bartlyons.
The FIN number is 92854074.
FIN number 92854074.
His medical record number is 681834.
Medical record 681834.
And the patient is B positive.
B positive.
So now I'm going to give you the donation information, which is at the bottom half here. So you've got, should be donation number C0540-1964234N.
Okay, donation number C0540-1964234N.
That's right, and it's a red blood cell and it's B positive as well.
Red blood cells, B positive.
And the cross match is compatible. And the cross match expires 2017-0430 at midnight.
2017-0430 at midnight.
Perfect. So we've done our second check because it's patient to patient is correct, donor to donor is correct. And so we are done with this sheet until we start infusing it, and then we'll have to write on it saying what time and date we initiated the infusion. Next is the tag to the blood bag. So there's no patient information on the actual blood bag, it's all donor. So we're just checking the bottom half of that tag. It's C0540-1964234N.
C0540-1964234N.
Yep, and it's B positive red blood cells.
Red blood cells, B positive.
And the expiry date matches 2017-0430 at midnight.
2017-0430 at midnight.
Perfect. And then just do a visual inspection, making sure that there's no clots or cloudiness, that your blood looks good to go. Okay, thank you for checking. We're just going to have to fill out this sheet here, Tracy, before you leave.
Yep, I'll just move over to this side.
Okay. So write down the lot number or take the sticker off the back if there's one. I'm going to say that it's 10:15 now. So if you just want to sign that, Tracy. Okay, so before I hang this, Mr. Lyons, I'm just going to kind of go over a few things that I didn't go over before, but I gave you the blood transfusion fact sheets for you to read over, but one of the things that we need to know is once I start transfusing this blood, that we're going to be monitoring you closely with your vital signs, your blood pressure and your pulse, and also if you start feeling anything abnormal than what you feel right now, you must let me know, such as fever, chills, chest pain, back pain. If you're getting like a rash or itchiness on your skin or shortness of breath, you'd want to like call a nurse right away. But I'm going to stay with you for the first 15 minutes. But let me know if you experience any of those reactions. So my blood is going to get hooked up to my other Y port. So before I hook anything up, I want to make sure that I clamp off my normal saline line because I don't want normal saline to be backed up into my blood. So once I've got that connected, I'll open up my red blood cells, and you might have to just squeeze the drip chamber a wee bit. And then the policy says that we should prime the actual blood to the end of the line. So once I see that there's red right to the end, then I know that my line is primed with blood because I want to make sure that the blood goes into my patient first and not just saline during the first 15 minutes. So I'm going to turn on my pump. So one thing that I like to do with my blood is label the line. So you'd have to hit primary, change mode, press the up arrow, and you'll see label line. Hit select and then go down to blood. We know that the first 15 minutes the rate needs to be slow, and the policy states 50 mLs per hour, and the volume will be whatever the volume is on the bag. So this one says that it's 300. When I hook it up, I'm going to want to make sure aseptic technique, and I should have gloves on. There's some up at the top there, Tracy. Because I'm dealing with blood products. Thank you. Yep. So the gloves I should have had on when I was actually priming this because you are dealing with somebody's blood. So I've swabbed my port. I'm going to connect my blood line, get this into the pump. Start this. Just going to secure my blood tubing to my patient's arm. Okay, Mr. Lyons, we're going to start this blood now. So I'm going to stay with you for the first 15 minutes. I'm going to recheck your blood pressure here. And you're going to let me know if you're experiencing any signs and symptoms of transfusion reaction. So if you remember what they were fever, chills, dyspnea, which is shortness of breath, chest pain, back pain, or itchiness. So once the 15 minutes has gone through, I'm going to want to recheck his blood pressure. Take those off, wash my hands. So 15 minutes is up here. I'm just going to do my 15 minute after transfusion start blood vital signs and write them all down and compare them to my baseline. And if he's still feeling fine, the blood transfusion is going to keep going. But I must now check vital signs again after 30 minutes of initiation. So I have to write down another set. So in total, when I'm giving the blood transfusion, we need to do 5 sets of vitals, and I'll just go through them. They're your baseline, 15 minutes after transfusion, 30 minutes after initiation, at the end of the transfusion, and 1 hour post end of transfusion. So after 15 minutes, you'd want to make sure that you would come and readjust your pump rate on your line, because it runs at 50 for the first 15 minutes, but then after 15 minutes, you must then change your rate to whatever the doctor has prescribed. So he prescribed this over 3 hours, and my blood bag is 300, so my volume on my pump, the rate will be 100, and the volume still will remain at whatever I programmed initially, which was 300. So the only thing you need to change is the rate. And then if any of your vital signs have changed, you would maybe think about doing vitals more often.